Thousands of athletes rupture or tear their anterior cruciate ligament every year, and over the past 20 years, there has been controversy regarding the advantages and disadvantages of graft type used in surgery. Our purpose is to investigate the differences in graft laxity between a hamstring tendon and patellar tendon graft for an ACL reconstruction. Two tests are able to measure ACL laxity, and these are the Lachman special test and the KT1000 arthrometer. Both measure anterior displacement of the tibia relative to the femur. The Lachman's test is done by stabilizing the femur and manually moving the tibia anteriorly, whereas the KT1000 uses the same mechanism but by using a machine to get the measurement.
A common acronym for ACL tears is VERPS, valgus force, external rotation, usually with a pop, and there's immediate swelling. Your ACL can be injured if your knee joint is bent backward, twisted, or bent side to side. The chance of injury is higher if more than one of these movements occurs at the same time. Contact, being hit by another person or object, can also cause an ACL injury. An ACL injury often occurs during sports. The injury can happen when your foot is firmly planted on the ground and a sudden force hits your knee while your leg is straight or slightly bent. This can happen when you are changing direction rapidly, slowing down when running, or landing from a jump.
With an ACL tear, the signs and symptoms include pain, swelling, redness, inability to weight bear, instability, and the athlete will often report hearing a pop at the time of injury. After ACL reconstruction surgery, the signs and symptoms will be stiffness and immobility, pain at the anterior knee and or site where graft is taken from, significantly reduced range of motion, and swelling.
The initial steps to an ACL tear should involve immediate first aid. These first aid tips will reduce swelling and pain. Use the RICE method. These letters stand for rest, ice, compression, and elevation. You can do these by putting ice on the knee, resting it, using elastic bandage to give gentle compression, and elevate the leg by propping it above the level of your heart. And at first, it's also important to move your leg as little as possible. Take over-the-counter pain medicine. You may need to walk with crutches and use a knee immobilizer to keep your knee still for the first few days after the injury. The rehabilitation for an ACL tear can be anywhere from 6 to 12 months of treatment, and return to play decisions are made on a case-by-case basis.
All right, moving on to some of the frequently asked questions about the graft. First question is, what if my surgeon is strongly recommending one graft type over another? The answer: the surgeon commonly have a graft preference to use, a surgical technique that they like, and they also take patient-related factors into account, such as age, gender, and activity level. Choosing the graft type that your surgeon prefers is the most beneficial, as they may be more comfortable with that type.
If you suspect an ACL rupture, see your doctor immediately. Seek the appropriate rehabilitation and also ensure you communicate with your healthcare providers. You want to tell them your exact signs and symptoms and give a detailed history of the accident.